back to AI Pill, the podcast where we break down AI in healthcare in just 10 minutes per episode. I am Daria, your host, and today's episode is all about a type of AI that you have probably encountered without even realizing it: recommender systems. If you've missed our previous episode, I strongly recommend you to give it a listen on our YouTube channel or Spotify to just get some foundational insights. Joining me today is Anton Balakirev, CEO of Digress, a startup that uses AI to improve patients' care outcomes in intensive care. Anton, we hear about recommendations all the time in our daily life, but can you help us understand what the recommender system actually is and why it matters in healthcare?
Hey everyone, of course. Let's start with something simple. Imagine you're browsing Netflix and it suggests you a movie that you end up loving. That's recommender system at work. Essentially, it analyzes all your interactions with the platform, considering your likes and dislikes, considering year, country of movie origin, its genre, actors, and hundreds of other parameters, and match it also with preferences of millions of other users and those other people who watch this movie. And everything for one goal: to find the movie that you like the most.
Yes, I see this all the time on shopping websites and on Netflix too. I once signed into my friend's account and it was a totally different interface, like it was a different website. And it's interesting how much the system knows about us. So how does something like an online shopping recommendation translate into healthcare?
Good question. In healthcare, we also deal with choices, but instead of picking up the next movie, doctors choose the best treatment for patients. Imagine that the system that can suggest optimal drug dosage based on the patient's medical history, lab results, and history of interactions of this drug for hundreds of thousands of other patients. Or consider a system recommending personalized rehabilitation exercises for patients recovering from the surgery based on their own recovery progress and past outcomes.
So it's like having a guide offering a personalized suggestions for each patient's situation.
Yeah, exactly. Recommender system in healthcare work the same as in commerce or advertising industry, with one significant difference. They rely on patient data. And this is one significant problem that we face, because patient data is hardly available for training models and very private. As I said before, I was working for several years in machinery, and we could predict bulldozer failure 2-3 months before it really happens, because we had all the telemetric data and all the history of maintenance of this machine and the whole fleet, and the models were quite accurate. For instance, in intensive care units, very often nobody can say what will be the next 30 minutes. And it's very stressful for everybody. But things are not so bad in intensive care. So do you remember we mentioned the feminine heart study previous episode?
Yeah, sure.
Yeah, so this is also a simple version of a recommender system. So they use a linear regression model to predict heart disease, considering different risk factors with different weights.
That sounds incredibly useful. I remember working with oncology specialists, and it was always challenging for doctors to understand the correct dose and the type of the drug. And the protocols were complicated and unfortunately sometimes didn't provide expected results.
Yes, oncology is a good example where AI-based recommender system can help identify the best treatment protocol for cancer patients. By analyzing the patient drug response and the medical history, this system suggests effective drug dosage. And some such solutions are already FDA cleared. Fun fact that developers of such kind of solution, they don't call them AI-based, but based on some mathematical algorithms, for instance, Bayesian algorithms, which are considered as a machine learning by definition.
You know, I agree with it. AI is probably good for investor speech, but when we talk about clinical studies, it's better to be more specific. And so such system is like combining experience of thousands of doctors with the data from thousands of patients in one tool.
Exactly. And it's never about replacing doctors, but about second opinion and saving doctors' time. And it's not just oncology. Such kind of clinical decision support tools can even help a diagnosis of rare disease or to help millions of patients with chronic disease like diabetes.
But that's not all, right? So if Netflix is wrong with the movie recommendations, so I can lose some time in the evening. But if there's a problem with the diagnosis, it can be extremely dangerous for patients.
That's a great point, and it's crucial for healthcare. When it comes to AI, we very often talk about explainability, being able to understand why model gave a specific recommendation. And a good model doesn't just spit out an answer. It should also provide weights of or importance of each factor behind the decision. And in this way, clinicians can see why systems suggested this specific treatment and verify if it aligns with their clinical judgment. And you're absolutely right about issues with model accuracy, biases, and other things that I would like to discuss in one of our next episodes.
That's reassuring. If doctors can see the reasoning behind AI, it's easier to trust the system. Can you give us a specific example of how this works in deep breaths?
Of course. At deep breaths, we use AI to analyze time series data from lung ventilator. One of our key tasks is to detect in patient ventilation asynchrony, basically moments when ventilator doesn't feed patient breathing efforts. We analyze, deep breath analyzes 100 data points each second to detect these critical moments. And since we work with gigabytes of data, it's almost impossible for end users to validate models' decision based on raw data. That's why we added visualization tools, and each user in few clicks can validate accuracy of the model and understand all the underlying factors that led to this decision.
That's great, Anton. Thank you very much for helping us to understand recommender assisting a little bit better. In our next episode, we will touch upon computer vision and its growing role in patient care. Thank you for being with us today. As always, you are more than welcome to leave your comments and ask questions after this episode. And I would like to take a moment to thank the whole Depress team for their hard work and for making this episode happen. Stay tuned.